There it is. So, but please feel free to use the chat during the session, comment, ask questions. Just keep your mics muted during the session. And if at the end during the Q&A, if you want to speak, please just use the hand raise reaction in Zoom. The slides and handouts are all in the Documents tab of Whova. So you'd go to Session Documents, and there's a PDF there that you can access, and you can find this session and follow along. There are notes, a notes page in page 14 of the program. So please join me in welcoming our presenter for this session. Dr. Enjolie Lafaurie is a mama, sister, tia, comadre, widow, doctor of psychology, hypnotherapist, empath, death midwife, and a business owner. Originally from Southern California, she is of Afro-Cuban and Guatemalan descent. Dr. Lafaurie is a former professor specializing in the psychology of gender and culture. Her degrees from ASU and USC were in counseling, psychology with an emphasis in multiculturalism. Dr. Lafaurie's passion for diversity led her to teach the prevention of HIV and AIDS, malaria, and other culturally bound practices in Tanzania, Africa. As a certified hypnotherapist, she incorporated this skill set into a private practice. She also received training in mindfulness and biofeedback at New Mexico State University. Currently, Dr. Lafaurie provides services and leadership nationally, and within her local community. She co-hosts a weekly show titled The Nightly Restorative Check-In for the National Parents Union, and is a regular guest on the Spanish broadcast titled El Sindicato Nacional de Padres. Enjolie is the COO, CFO for the Siwapakli Collective, a nonprofit organization that supports Indigenous women and families to reconnect with ancestral knowledge through wellness practices. Enjolie also merges her expertise in diversity and inclusion with that of contemplative practices. She incorporates neuroscience, mindfulness, and meditation to navigate challenging conversations around the topic of equity. As a small business owner, Dr. Lafaurie teaches courses that merge concepts of business with psychology and culture. And we cannot wait to hear what you have to tell us. Take it away, Dr. Lafaurie.
Thank you so much, Kendra. I know there are a lot of challenging words in that bio, so you did a great job. Hello everyone. I don't know about you all, but it is weird to hear your bio read. And I hear my bio read frequently. Good morning, good afternoon, wherever you find yourself. So happy to be here with you all. I really appreciate the way that the conference has been opened. I'm so grateful to be following Maria del Carmen, I call her Carmen, because we've already done good things like opening space, right, and acknowledging the land. But just again, want to just give my gratitude for the space that I find myself in, these territories that we're on, this O'odham land, Acapulco O'odham land. So I have a packed set of slides that I kind of want to get through. Again, in continuing with my thanks, I want to thank the organizers for this conference. So I'm going to share my screen. I'm going to share that this is a part of my dissertation work, and so we get really tied to like our dissertation and the information. So the slides, like I said, are packed. As far as I understand, you have access to everything. So please, just read along, listen along, knowing that you have all the content there if you need it. Let's see, I'm going to share my screen now. Oh, the other thing, please feel free to ask questions as you see fit. I'm okay with you opening your microphone. I know that the conference has, kind of as kind of creating a little bit of a culture of raising your hand. Do what you need to do, but I'm okay with you interrupting me is kind of what I want to say. All right. Okay. I hope you can see the majority of my screen. Okay, so I'm going to get started. Y'all can see my screen, yes? Yeah, all right, awesome. Okay. So I want to thank you for the introduction. I want to introduce some other parts of myself. And this is always just a good opportunity to like see pictures of our parents when we liked, when they were young, right? But I, as Kendra said, right, I am Afro-Caribbean. We are Taino and Arawak, and Guatemalan Maya on my mother's side. I'm also a mom to a 21-year-old daughter. And from the introduction as well that I'm a part of the Siwapatli Collective. If any of you transferred from the previous session, the best way that I like to summarize our work is that we support Indigenous families from womb to tomb. So let me quickly talk about why hypnosis, and like how did it even make it into the conversation of postpartum, excuse me, or the conversation of birthing. So this is my sister on the right side with the cake pictured in front of her. And when it came time for her to birth within my family set, she was the first person to become pregnant. And although I was already a hypnotherapist, I was a hypnotherapist as of 2007, I had not used hypnosis to birth. So she asked me, she knew that she wanted to use it and utilize it, and she asked me to support her in that process. So she used actually a hypnobirthing method. I'm not reviewing methods of using hypnosis to birth here. I'll talk about that in a little bit. So I'm just talking about generally any kind of program that uses hypnosis for birthing. But anyway, so she asked me to support her in this process. And then here came, right, Emmanuel, which is the child, the baby that pictured here that's, kind of grown up over time. One of the most important things that I noticed when my sister was in her cuarentena, which are the 40 days following birth, right? Following giving birth, I noticed this wisdom in her, right? I noticed all of this knowing, kind of knowing what to do when it had been many years before anyone in our family had given birth. And we observed the cuarentena in the sense of that my mother was living with her at the time, so she was staying there. I came and stayed for weeks at a time, and we had other people come in and provide kind of support and food support, emotional support, kind of laundry, and all the things that somebody needs to kind of make their house operate and run. And as my sister experienced challenges with her son's health, I saw again this innateness. And that was when it came to me. I was like, you know what? You used hypnosis. She very effectively used hypnosis for birthing. What is the connection? Because sometimes we only think about these programs as being for birth. What is the connection between the use of hypnosis and postpartum adaptation? I didn't know that word then, but that's what it was. Postpartum adaptation, how you kind of get to restructure yourself afterwards by using this method. So that's where this idea came from. That's where dissertation came from. And I think it's also just important. I'm, of course, just grateful. We all feel full when we can talk about our families within our professional setting. But it's important to not divorce, right? Only our minds from our hearts, from our lineages, from our culture. And I, really want to, that's why I enjoy telling the story so that you can kind of hear this came from cultural knowledge. This came from just spending time with the people that I love, noticing and being an observer was around me. So great questions come out of just our natural observation. Okay, so let me give you a definition of hypnosis, just to make sure we're all on the same page. I like to tell people as well that they may not know that the Society of Psychological Hypnosis is actually a division of the American Psychological Association. I don't know. Generally, I think of people who are attending a birthing conference as being really open to ideas of hypnosis, but it's not common. It's not widely known. So generally speaking, we think about hypnosis as a technique, right? It's a technique where clinicians make suggestions to individuals and that are undergoing some sort of process to relax, right? To focus themselves, to center themselves. You're kind of in between states of altered states of consciousness. If we think about, right, our brainwaves right now, you're in a pretty, hopefully I'm not killing you with my words, or boring you to death. Hopefully you're pretty alert, pretty aware, right? And you have that experience when you enter different levels of trance. So that's what we mean when we say different states of consciousness. All right. So because this is, kind of reviewing some dissertation work, I have quite a few citations, quite a few connections back to literature. I'm going to kind of speed through some of these. Again, you have them, and you have the information there and accessible. So some of the relevant literature regarding hypnosis and the way that we use it for birthing reveals that when we use hypnosis, it allows patients to have greater participation in the birthing process, right? They're able to advocate for themselves if needed, or just kind of be more engaged with the birth, as opposed to trying to maybe remove yourself emotionally or mentally from what is can be, right? Well, it's often a very painful experience. Faster recovery time, shorter hospital stays, right? Because one, you're birthing faster, but then also, let's say there's not as much trauma or damage, right, or tearing and things like that during the time of birth, then you're able to kind of move along and speed through your recovery process and begin postpartum in your more natural setting. And then there's less discomfort, right? And again, like I said already, shorter labor. One of the things when I talk about this thing called maternal adaptation, that's really important, is that during a woman's pregnancy, and realize that I'm using gendered language here. Part of that is because everyone in my study identified as a woman. So I should be using the term a birthing person. But during a birthing person's pregnancy, some of the key components are that they experience control, support, and awareness. And if that's important during pregnancy, that also begins to become important during their postpartum phase. So if hypnosis can help or support a sense of having control, support, and awareness, then right, we start to notice that can also carry over into the postpartum phase. And so if a birthing person has these, it contributes to their sense of having a successful postpartum maternal adaptation, which is that concept that I keep repeating. All right, so quickly, right, what are some of the ways, and you know this, especially if you're birth workers, right, you know the ways that you can recognize if the family and the person who's given birth, right, if they're adapting successfully, if they feel good, if they feel comfortable, regardless of the way that the birth happened. So maternal adaptation is indicated by being able, right, so the birther being able to meet the physical needs of the baby, being able to observe and interpret and respond to baby's cues, being able to help your family adapt, right? So here's a new person, a new life that has come in. Everything's shifted and different, hopefully not turned upside down, but it's shifted and different. So making sure that the family's working together well, and being able to adjust and maintain our boundaries in so many ways, our physical boundaries, like with our body, right? Especially if we're chest feeding or breastfeeding, maintaining our boundaries in our relationships with the people around us as well. One of the other things that's important too is during postpartum adaptation is to restructure, right? We have to adjust so many views when we are postpartum, right? So we have to adjust maybe negative views of pain, or even we don't talk about it enough, we sometimes have to adjust negative views of our child, right? Which is a really uncomfortable conversation or realization for us to have. We have to adjust our views of pain. Also gaining and support from others. Carmen was just talking about this in the previous session. It's hard for a lot of us to ask for help, right? And when we are in our postpartum phase is one of the times where we maybe need the most help, and we don't always allow ourselves to receive it. Also our body concerns, right? The ways that our bodies have shifted, right, to engage in this miracle called birth. Not everyone calls it a miracle. Not everyone displays it as a miracle. And expressions of hostility. So this is when we think about maybe postpartum depression, postpartum anxiety, and also I would just say just your regular old emotions, right? Of just having kind of difficult responses and reactions and frustrations to your baby or to your partner and your family that's supporting you. Primarily, I would say motivated by pain, but also by social emotional reasons as well, or because of social emotional reasons as well. All right. I feel like I'm speeding through. I'm going to keep going. Somebody stop me if you have questions. Okay. This slide, I'm just going to focus right now on the resilience model. And so because, yeah, go ahead, Elizabeth.
Sorry, thanks. I have a question from Dr. Kara English, and she was asking me to ask you that she said that some of her clients feel that altered states of consciousness are contrary to their Christian beliefs. When it's time for questions, could you answer that? You want to answer it now? Or you want me to hold that for later?
No, let me try do a part of it now, and then I'll start to come back to that. Yeah. So, so much of one of the things is on that definition slide, there were two different definitions that I used. So words and language are powerful, excuse me. And so, use the definitions that suit your clients, use the wording that suits them. When we talk about an altered state in consciousness, whether or not I would say whether or not we believe in it and use the belief from a spiritual and religious place, it is what the brain does, right? So our brain goes through different levels of awareness, right? Different levels of consciousness. And so that's actually scientific literature. So you can, those are words we can borrow on with our clients. We can talk about like our different levels or different brain waves. So I would just use the language that is comfortable for your client. Yeah, I might, where I want to go and what I'm thinking about is kind of one of those things of we never want to negate our clients' spiritual beliefs, right? But at the same time, I think as practitioners, sometimes we do know that there are some things that are metabolically, physiologically going on in the body. And so we just have to find a way to kind of make it fit their cultural frame of reference. So hopefully that helps. And if not, you can come back and ask me, the question in another way. All right, so I wanted to talk about resilience models. So what's important here is when we talk about resilience, right? If we view resilience as a learning process, if we view the ability to adapt, to change, and to adjust as a learning process, then if we learn to hopefully effectively utilize hypnosis or a relaxation technique during birthing, then we can also use it later on, right? In our postpartum phase or postpartum time. One of the things that we know about resilience is that also there are protective and vulnerability factors that contribute to resilience, right? So one of the things that we see is that hypnosis can allow us to start to get a sense of having high internal resources, right? Fancy words like self-esteem and self-efficacy and knowledge. Basically, I believe in myself. I believe that I can do this. I believe that I can accomplish this. For some of us, in more of a cultural reference, it's going to be, I feel like I'm not alone, right? I feel like I have support, but that's building all those internal resources, right? And then external support, right? Getting support from other people as we're learning something, that builds our resilience. And those factors are often common in the process of using hypnosis for birthing. I should say hypnosis for birthing, this is not the only way, right? So this was in this one study, this is what, I researched, but many of our cultures have contemplative practices, have ways that we go inside, that we address pain, that we address our focus and our attention and our concentration. So again, I'm only talking about hypnosis. I'm aware that there's many other ways that cultures utilize these methods, right, to address pain. All right, so I've said this word a lot, or this phrase a lot, excuse me, hypnosis for birthing. Some of the philosophies behind it, right? We view birth as a natural process, and say we, right? Hypnosis for birthing views birth as a natural process. We know that utilization of these techniques can help in confidence, that internal resource, right? By decreasing fear. For those of you who are not familiar, the fear, tension, pain cycle is particularly important, right? So the more fear we experience, the more tense our bodies become, right? The tighter and more constricted they become. And that's actually maybe why birthing is prolonged. If I say that in a different way, that is the reason why people who can use hypnosis for birthing have a shorter birthing rate, have a shorter time in labor, because they're able to not be in that fear, tension, pain cycle as long as their counterparts would be, who maybe didn't use hypnosis or some other type of technique like this. For those of you who have never heard about hypnosis for birthing, generally it's taught prenatally, right? And it either can be via small class setting or at home. I'm sure they're doing it via Zoom and all these good things now, MP3 files, all that good stuff. Okay, I already talked about my research question, but I'm gonna speed along. This is for the nerds. the researchers, right? All the participants, who was there. So really quickly, what we did for the study, mothers were recruited that used hypnosis for birthing programs. And so this included hypnobirthing, the Mongan method, hypnobabies, Blissborn, and the birth hypnosis method. Somebody asked me a question on HUVA and so this is responding to your question of which programs. Submit a question? No. Okay. And then there were semi-structured interviews, right? And which were analyzed using grounded theory. Again, I'm going to just say the most important parts of participants. There were 17 mothers that were interviewed. They split, they identified themselves as Caucasian, Hispanic, and multiracial. I think one of the big things to know is that the moms in this study that used hypnosis for birthing, they were pretty educated, and I would say certainly middle class and above. So take that. It's important to know the context, right, of who it is that we're speaking to. Most of these families were also married or partnered. So yeah. Okay, so what did we see? And how did this connect, right, to hypnosis for postpartum care, right? So moms who had 2 or more children, if they were able to use hypnosis, and so not everyone, let me say this, if they were able to use hypnosis effectively, right, not everyone was able to do that, or they didn't feel that the hypnosis worked, right? So I'm not shying away from that. Any birth workers who know this know that sometimes birthing folk can kind of try to use these methods and they feel like it doesn't work, or they don't feel like it's successful, right? So those stories are also reflected in this experience. So those who had 2 or more children, they felt that they appreciated their birth more than their previous deliveries. Appreciated in the sense of it went better. It was shorter. I experienced less pain. I was more calm. And I think less pain is different than no pain, right? They were able to make some connections, that being able to utilize hypnosis during birth impacted their bonding with their newborn, impacted their sense of self-efficacy. I think I can, right? And breastfeeding or chest feeding, and then just overall connections to hypnosis with their postpartum success. First-time moms, right, they appreciated the physical recovery after delivery. And there was also just a big emphasis on the birth narrative, right? So kind of with the ways that they were able to talk about their birth, they were able to put it in context either of being connected to a lineage of people who have birthed before, right? Or being able to really tap their internal resources. And again, the births, that one of the most important things I'll say that I learned through my dissertation work was actually the importance of the birth story. So I would just, I hope that, and I think this crowd probably knows that already, but the importance of allowing people to tell their story and the sacredness of that is often lost, and in other cultures still remains intact. Okay, first-time moms, they also, some of them attributed their successful adaptation, right, to the use of hypnosis, and the same thing, made connections to the bond with their babies through self-efficacy and breastfeeding or chest feeding. Some of these slides, again, I wanted them to be here for you all so that you could take the information from them later on. One of the things that I would say is that most of the individuals in the study did end up feeling bonded with their child. Some of them attributed it to hypnosis, some of them attributed it to breastfeeding, and so maybe not necessarily hypnosis. One of the things that I think is important as we think about how hypnosis can help in postpartum phase is that there's so many times and places in our postpartum journey where we're dealing with pain. One, primarily breastfeeding, right? Everyone, a lot of people know what that first latch feels like in the morning. Also, there's if somebody has had a baby through cesarean, right? There's all these times in the postpartum phase where individuals are going to have to deal with pain. That is something that I feel like is important to leverage, and that I don't believe that everyone makes that connection. So some of the mothers in the study were able to make that connection, and they were able to kind of experience that transfer. And it's actually called stealing resilience in the literature. You're able to steal all those internal resources from one scenario and apply it to another one. I'm going to keep rolling. There's quotes in there. It's in those green buckets as you're looking through them. How am I doing on time? Just to make sure that I'm leaving enough time for questions.
You're doing great. You've got about 20 minutes until
Okay.
we need to wrap up completely.
Great. Okay. Just want to make sure I have time for us to chat. So also, right, as I said, breastfeeding success. Now, ironically, some mothers, they did feel that even if the hypnosis did not work for them, meaning they didn't have the experience that they desired during their birthing process, they did attribute their ability to breastfeed despite the complications during birth. That was a way for them to feel connected to baby. That was a way for them to cope with their feelings of guilt. I think one of the hardest things, and that I think as I've talked to birth workers in the community about folks who use hypnosis for birthing, if it doesn't work, that individuals can feel like they did something wrong. And so the ability to like, okay, well, I could still make a connection with my baby was reparative for them. I can still make the connection through breastfeeding. That was reparative for them. That was particularly true for mothers who identified as being Hispanic, right? That made them feel like their postpartum was successful. So much so with some of these moms that they started to use breast milk sharing programs. In no way am I saying that it's only specific to Hispanic families and not Caucasian families, right? But again, that's what happened in this study, right? This desire to, I want to share, right? I want to share the resources that my body's making. I want to share the resources that I have with others. Self-efficacy, again, that idea, that concept of, when I say I think I can, I think of like, the little engine that could. Self-efficacy is this idea that I can set a goal and I can attain it, right? I can work to, and I believe in my ability to do that, which is different than self-esteem. Self-esteem is often related to your worth, and it's more global or general, as in I am a worthy person, right? Self-efficacy is often really specific to the task at hand. So hypnosis for birthing indirectly led to self-efficacy, right, among this set of Hispanic mothers, right? They really felt like, right, I've accomplished this plan that I set out. I've accomplished what I set out to do in the way that I thought was possible. And many mothers in the study discussed feeling like they were not supported by their family members in their birthing plan. And so that was even more important to them of when they were able to execute it, an increased feeling of self-efficacy, which then translated, not only do I know what I need for my body, I also now know what my child needs. And I feel really confident in being able to kind of deliver care for them, right, for the postpartum phase and beyond. Let me keep going. So some of the themes, right, of mothers with unplanned events. Unplanned events meant that the hypnosis did not go as planned. They did not feel that they were able to kind of relax. The pain was more intense than they had, anticipated or created in their mind. Some others did end up using intervention, right? Did end up having to utilize an epidural and or one. I can't remember right now how many mothers had to use it. I went to cesarean, but I do know that there was at least one. So anyway, things going not as planned. They were experiencing feelings of guilt, which I already mentioned, right? I think that's one of the biggest detriments and conversations that anyone who's dealing with somebody who's considering hypnosis for birthing, to have this conversation around, that, and if it doesn't go as planned, it's okay, right? And that they are not at fault, that they haven't done something. One of the limits of, I think, psychology, one of the limits of programs that are based on the individual trying to access their internal resources, separate or devoid of a conversation of connecting that to community, is this idea that everything that I do makes this pregnancy be successful. Everything that I do can then also make this pregnancy be unsuccessful. And so it leads to those ideas of guilt, right? So when people can access, okay, who I am in this tool that I'm using, it's one tool, it's one resource in my tool belt, they do better, right? And they will experience fewer feelings of guilt, as opposed to someone's like, no, this is the exact plan. And when it doesn't go as planned, then they blame themselves. So that makes me certainly sad for them. Some, right, viewed hypnosis as an isolated tool for birth, and then they were able to use it later, though, to reduce guilt and stress postpartum. And I will say there was a practice effect, right? So those, I don't mean that in the way that we typically say it in research, but those who practiced more, meaning utilized, practiced with their hypnosis methods in pregnancy more, were more successful. Their labor was shorter, and they were able to incorporate these techniques despite their own skepticism or the skepticism of those around them. Couple more slides and then we'll kind of open this up. Increasing resilience. So those with prior experience in hypnosis, their internal resources led to better maternal adaptation. So remember these ideas of control, supportive awareness, and support and awareness, right? The idea that I can respond to my baby's cues, I'm in control and aware of my body, I'm able to kind of integrate all of my family members and restore all of the relationships. That's what we're talking about. Successful execution of their birth plan and the reactions of others to their birth plan, when people were able to shift and like, oh, you did that, you were able to do what you wanted, right? Their feelings of competence increase, right? And then they thought, okay, I can continue to transfer some of the skills learned from using hypnosis into my postpartum phase. Hypnosis techniques may have helped mothers who experience unplanned events to successfully breastfeed, and many participants said that, right? Same things that I used that maybe didn't work there, I used it when I was tired, I used it when I was frustrated, I used it when I was not feeling good. And then one thing that's important too, that maybe was not shared in the participant slide, is that I would say about half of the moms who participated in the study, they were experiencing depression and anxiety before they became pregnant. So many of the moms who elected to use this, they knew that they were maybe going to have to kind of stop utilizing their medication, any medication that they were using for their depression and anxiety, psychotropic meds, and they wanted to use hypnosis to be able to help them not only deal with pain, but deal with their fears. There was probably one of the quotes that sticks with me the most is one mother that had shared experiencing trauma, and that she shared that the loss of control that she experienced in the through birth was very triggering for some of her trauma. And this was a mother who had birthed multiple children, so she was using this method on her third birth. So she was able to use hypnosis so that it would allow her to not experience that loss of control and to kind of walk through that, especially during, crowning phases and phases right before, you're getting ready to give big pushes, right? Before baby's gonna start to come into the world. So I think that's really important. And so they were able to reduce their medication because they had to, but then they were able to kind of use these methods to help them with depression, anxiety during the pregnancy, and then also postpartum as well. Just want to kind of share these two last slides and then we'll chat. As you know, right, I'm a part of the Suyapatli Collective, and you heard Carmen talk about this if you were in our previous session, right, where our Ancestral Womb Wellness Gathering is coming up here in June. And so feel free to connect with us if you would like to attend. And then these are the ways that you can reach me. Either reach me or the collective if you're wanting to connect with us. But those are some of the most important things that I wanted to share with you all. I would love to open it up for questions, reactions, and just see how you're receiving this information.
Yes, everybody feel free to unmute yourself and ask questions.
Sure, this is yeah, I have a question for you. So Dr. Enjolie, I used hypnobirthing to prepare for my birth, and it never dawned on me to even engage that in the postpartum time. I did use it when I felt like I was like wired, but not tired, where I knew I was exhausted and I needed to relax. And that was the only time I actually engaged it. So I guess my question is, is there like, because thinking back, how would I have used the same techniques I learned in my hypnobirthing, or is there a little tweak to that to benefit from it in the postpartum?
Yeah. So for anyone who's used these methods, right, especially if you're like CD bound or MP3 bound, whatever they're using now. I know that it's MP3s, but anyway, when we're using hypnosis for birthing, it's a lot of stop and start, right? So anyone who's gone through any guided meditation and things like that, we're used to this idea of like a script, right? Something that we're hearing from start to end, and there's no stopping, right? When we're utilizing hypnosis for birthing, there's a lot of stop and start of where you are using this method to go with your contractions, right? In fact, I know one of the methods talks about like a light switch, So think of it as these are all skills and tools, right? You can use a light switch idea if you're connected to that, right? If you're connected and you've learned that, you can use that light switch idea when you're experiencing acute pain, right? But many of the methods also have longer meditations to kind of support your learning of how to kind of distance or distract yourself from the experience of pain. And I think those are the ones, like more of the longer ones, when I say longer, like not interrupted ones, are the ones that I think would be better during postpartum phases. Hopefully that helps. Yeah, thank you. I see comment. Let me try to put the chat on the side. Okay, cool. Got it. I can see comments now. Other questions and I'm open to reactions and us having a conversation, because I absolutely know that the stuff doesn't work for everyone, or they have questions, or they think it didn't work. I think that's also a big thing. So sometimes, right, people feel like I didn't even know what to expect, right? So I'm open to all your thoughts. Go ahead, Magical Mama.
Hi, thank you so much for this presentation. This has just been so valuable. I'm a hypnotherapist as well. And so I was curious, and I'm also a home birth midwife. And so I was curious, have you seen hypnosis be supportive for moms in processing traumatic birth experiences? It's something that I'm interested in learning more about and maybe diving into in my own practice, because, there's just, especially over the last year with COVID and, so many moms not being able to be with their partners during their birth or with their doulas during their birth. And there's been a lot of, mental health crises increase in general. And of course that affects birth. So I was curious if you've seen any research or you yourself have done that, or how hypnosis can support us in healing from our birth trauma.
Yeah, so I'm going to say more so in the time that I was studying, kind of being taught hypnosis, right? Hypnosis is particularly efficacious, right? Helpful for dealing with pain, period, right? That's actually one of the best ways to utilize it. The nice thing about using hypnosis to deal with trauma is that it can allow, sometimes when we're having to cope with trauma, it's all too much. It's overwhelming to have a conversation. It's overwhelming to pull back some sort of memory, but we have to process it, right? We have to go through those emotions and those memories. So hypnosis does a nice job of helping us isolate the parts of a story or of an experience that we're willing or able to process at that point in time, right? So what do I mean by that? I mean, I think it's clear, but let me give you a concrete example, right? We can fly over, right? We can literally I'm going to put my emotions in a box. I can do, I'm going to put this reaction in a box so that I'm only dealing with this one particular aspect of what is a story, right? And when I'm saying what is a story, not trivializing the experience, but my point is a memory is a story, right? So as I'm retelling things, I'm going to be able to deal with a part of the story in a way that feels digestible and more comfortable, right? So I shared, I was talking about one of the moms. It was just, again, it was one of those moments that just stayed with me, right? Where this individual talked about having a history of trauma and the fact that she knew in her previous birth that every time she went to the point of pushing, right? And she was feeling, sorry, I think I said crowning, but when she entered transition, that reminded her of previous experiences with trauma. using the hypnosis for birth allowed her to disassociate what she had the connection she had made of loss of control with trauma to, no, I can allow my body to do what it needs to do, right? So I can let go, which is what we need, right? We need to open, the body needs to expand for birth to occur. And then so she wasn't re-traumatized, right? And then that was helpful. Connecting back to, yes, I don't know of literature that says that talks about ways to use hypnosis to address birth trauma, but in general, we know that hypnosis does well with addressing trauma and pain. And so I would consider using it that way.
That's awesome. Yeah, I can imagine like removing anchors, in a way for that. That's awesome. Thank you.
Yeah, absolutely. Yeah. And I think, and also just telling the story, there's one more thing I want to say about that that's one other thing I think that I learned through this study, and then also that I'm reminded of often, right, within the collective, of just having community and space to tell our birth stories, right? Because also, at least two individuals are birthing, right, during the birthing process, right? The person who's in labor, right, and the person who's coming earthside. And so we need space to process all of that, because it's not only a physical process that is occurring depending on your belief system, right? There's a spiritual process, there's a physical process, there's an emotional process, and you're essentially open. In Spanish we say dando luz, like that means you're giving birth. It actually, if I were to translate it literally, it's giving light, and so your body has to open for you to give light. And then also this closing also has to happen, which is then why we go into a cuarentena. We go into these phases afterwards of packaging ourselves back up together, and reintegrating everything else. Other questions or thoughts? I'm trying to get through like all the comments here. Thank you for them.
Would you like me to read some out to you? Would that be helpful?
That would. Thank you. Yeah.
So we have a comment from Emily, who said that you gave us wonderful presentation, and it just jumped. Hang on. She was asking if you published your findings from your dissertation, and if so, where could she find those?
So you can get my dissertation through ASU. I'll also send it to you if you want to send me an email. I'm not y'all can have this information. I'm not a hoarder of info. But yes, you can access it through kind of ASU dissertations. So
wonderful, thanks. Maybe you can pop that in the Q&A from the Huba app. I'll give you a reminder later. That'd be great. Thank you.
Okay. I will also just share an email address right now in the chat. But go ahead.
Perfect. There's a couple different questions that are talking about just like, what is hypnobirthing, and where can I go to find this if I wanted to know more, or what are the different resources that I could access?
Yeah. Okay. What is hypnobirthing? And I'm being careful, like, so hypnobirthing, that's one method. The Mongan method is another method, right? So think about it as like our grocery stores, right? There's Kroger, there's Safeway, there's, what else? What other stores? Whole Foods, right? These are all just the different types and varieties and brands. And actually there are more than I knew of before I engaged in the study. I would say that hypnobirthing, the Mongan method, and Blissborn are some of the larger ones, or more recognized. And I haven't recently reviewed programs, but there are individuals that also have their own programs. So when we're utilizing hypnosis for birthing, we're essentially being taught to enter into a state of relaxation that for birthing that coincides with or matches our contractions, right? Or kind of pressure waves is what they like to call them, right? We're shifting our ideas of what the experience is, and we're the goal for most people is to try to reduce pain, the experience of pain, so that most people who utilize hypnosis for birthing want to try to birth naturally, right? That's one of their goals, or birth without intervention. I will actually, let me throw in a story here. So I don't want to trigger anyone, so I have to think about how I talk about this. One of the individuals in the study used hypnosis for birthing, and they had experienced a placental abruption. So these are the parts where there's some medical stuff I'm going to talk about here. So this individual felt like it was being effective for this person's pain to be reduced. And so then because of the placental abruption, it was a kind of a 100% abruption. So it was kind of one of the most common scary situations that you should be in a hospital for, right? If you're giving birth, and so she experienced that, and they had to wheel her immediately to experience an emergency cesarean. They were not able to provide anesthesia as quickly as they needed to. So she did experience some of the first parts of the cesarean without anesthesia. And she said that she was actually able to utilize some of the techniques to experience that. There wasn't a long time, so please don't hear that there wasn't a long time. She wasn't experiencing pain or the cesarean kind of without anesthesia. But that I think is an important anecdote as well for you all to hear, that she was able to utilize some of those techniques. And then, really quickly the anesthesia came in, but they were moving so fast, right, that they just started to be able to save the baby. So the way that hypnosis for birthing works, like I said, it's often connecting to, instead of like when we're used to a guided meditation, start to finish, it's 10 minutes, we're doing the same thing for 10, 20 minutes. When we utilize hypnosis for birthing, we're charting our body, right? So as a pressure wave comes in, we're literally, some talk about turning on a light switch or turning a lever. We're accessing all the parts of ourselves that can kind of distance ourselves from pain or reduce pain. And then when the contraction leaves, then we're returning back to a normal state of consciousness, typical state of alertness. And so that's the method, right? The key method that's involved in using hypnosis for birthing. A lot of the ways that they're taught are through, like I said, CDs, MP3s, a series of kind of processes of teaching you this. And partners are also involved and I don't know if invited to be supporters, because there are words or there are images or there are scents, right, that can help somebody kind of connect to that relaxation response that they've learned. So that's a little bit of how it works. I feel like I missed another part of the question.
Yeah, and we just have time for a couple more moments of questions if there's another one.
I think you nailed it. And
okay.
If you didn't, please somebody put it in the chat for elaboration. There are two questions. You can take your pick as to which one you want to tackle with the time you have remaining. One is around birth story processing. What is this? How would someone do this? And why would someone do this? And the second one is, can you use hypnosis to heal past traumas, like childhood traumas, not just birth?
Okay. So I'm trying to decide how to time. Okay, so generally hypnosis can be utilized for anything that you're going to address within like a psychological framework, like whatever you go to therapy for, you can use hypnosis for, right? Hypnosis is a technique. So sorry, I know that that's like short, and so I want to say yes within the parameters. To the other question of what is processing your birth story, right? It means being able to tell your story and share it in all of the details and at the pace that you want to share your story, right? So I would say that this is not only important for the sake of when trauma occurs, but it's also really important when your birth goes exactly as planned. If I go to this idea of that you are open, right? Cuando estás dando luz, when you're opening up, which is, we only think in some cultures, we only think about it as physically opening up. But if all parts of you are opening up, we know that women who are in labor and then are pregnant become more creative, they become more intuitive. So this is what I mean, opening up. There are so many parts of that experience that need to be processed. Many of us process verbally, for sure me. And that's one way, So the telling, the sharing allows for the experience to be integrated back for the birthing person. And so one of the things that's also important about cuarentena is that we have to come back into ourselves, right? Because literally our body was a container for someone else. And that's often that restructuring that's happening in pregnancy is like, I'm wrapping my mind around, this is my body, but somebody's here literally in my body. And I have to get used to that. I have to figure this out. It feels weird to some people, and it continues to feel weird to them, even postpartum, right? And so when we get to tell those stories, right, it's the ways that we can use language to help us restructure everything that happened so it can fit in the places that we want it to fit, or we can make sense of some challenges. I'm going to stop there out of time, but like, I hope that that made sense and we can continue having these conversations outside of this space. So
yes, we definitely have space in the session Q&A in Whova to continue the conversation. Well, Dr. Lafaurie, I think that's just a testament to the your topic. It was very interesting and really, really packed with info. So I appreciate that so much. So folks, if you want to, we have our lunch break coming up. And so you can take lunch from as soon as this wraps up until about 1 p.m. Keep questions going in Whova in the session Q&As. And also during your lunch hour, we really encourage you to attend the sponsor and exhibitor fairs. They're in the Whova app and the desktop website. You'll tap the sponsor and exhibitor tabs to see all the booths. And many of them are hosting showcases to answer your questions and promote deals and do giveaways. And you can check the leaderboard tab in the app to enter the conference-wide contests and raffles. You can earn points for chatting in the community boards, posting photos, and sharing captions. We're giving away lots of great prizes today. The community board's a great place to meet with families in your area and engage in fun conversations, as we have seen has been happening for the past few days. So the afternoon sessions are at 1. They're packed with great presentations, including postpartum mood and anxiety disorders, art for relaxation, creating a 4th trimester ecosystem, and intimacy after baby. That is just naming a few. So you can add sessions to your agenda in the Whova app by tapping the agenda icon at the bottom of the screen. And if you have questions about any of the stuff I just said, we're going to stick around here until noon to answer questions about the conference in general. So we look forward to seeing you this afternoon.
thank you, everyone.
Thank you so much, Enjolie. That was lovely.